Hey, fellow patriots, I'm Bree.
And I'm Blaze. Some call me Pa. It has been said that we have 4 boxes to keep ourselves free. These are the soap box, the ballot box, the jury box, and the ammo box.
And we are the 4th box. We are here to arm you with enough information, resources, and skills to take back your freedom, increase your self-sufficiency, and inspire you to join in the fight against tyranny.
Thomas Jefferson said, "Eternal vigilance is the price of liberty." Thank you for joining us and for joining in this fight.
Welcome back to the 4th box. Welcome back to the 101st episode of the 4th box, guys. We are so excited. We have crested that 100 episode crux. So super excited to be joined by another guest this evening. Before we bring her in, Pops, why don't you go ahead and get us started with a toast and a quote?
Okay, yeah. Welcome everybody, listeners from around the country, all of the friends we've made over the past almost 2 years now. We certainly appreciate your support. And as always, we will remind you that the 4th Box podcast is coming to you from the safe confines of the virtual Buckman Tavern. And for those who don't remember or have heard of the Buckman Tavern, it's that venerable spot on the Lexington Green where those brave American patriots used to gather, discuss the problems of today. And on April 19th, 1775, the shot heard round the world was right in front of the Buckman Tavern on the Lexington Green, the beginning of the first American Revolution. So we are sending our cheers off tonight, and I am having a Belgian white beer in celebration. And my toast goes out twofold tonight to the Parents Demanding Justice Alliance, who are pushing for protection and restitution from those wrongs that were done during the last administration, where the government was weaponized against those parents who were going into school meetings and school board meetings speaking out against grievances that they had, and subsequently ended up being wrongfully targeted by an oppressive government. We're sending a salute out to them. Furthermore, we toast all who stood in opposition to any mandates, especially those related to personal health choices and those in the medical field who risk everything, standing in the face of government overreach and tyranny. We salute thee. Cheers.
Cheers.
Okay, for my quote tonight, the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. And that was from Thomas Edison. So there's our quote for tonight, and I hope those tie in nicely with our guest who's waiting patiently to be introduced.
Yeah, for sure. I think the quote from old Thomas was maybe wishful thinking. I don't think that is how it has played out, unfortunately. But maybe the more conversations that we have, like the one that we're going to have tonight, we can find our way back to what this was all supposed to be. So let's get started. Today, we're joined by Deb Conrad, a physician assistant from New York who was fired after reporting vaccine injuries to VAERS during the COVID-19 rollout. Back in 2021, Deb was accused of spreading misinformation and was escorted out of her job for doing what most of us would just consider her legal and ethical duty as a healthcare professional. While many have already moved on and forgotten about the fight for medical freedom, Deb is still standing right in the middle of it today, determined to seek truth and accountability. So welcome to the 4th box, Deb. Let's get right into it. Let's go back to the early days of COVID and how this whole story began for you.
Yeah, thank you both for having me on. Every time I do a podcast or a speak in front of people, I reach people who have not heard my story because I don't want people to forget. We can't forget because it's going to happen again if we do. So my story goes back to 2021. I was fired on October 6th of 2021. Prior to that, I had been a physician assistant for nearly 20 years. Most of my career was spent in a hospital setting. So I was an inpatient hospitalist, meaning I took care of patients that were admitted to a hospital system for, an acute illness, all different types of things. And my care was limited to adults because we did not admit pediatric cases at my hospital that I worked. So I mostly did adults. And, prior to COVID, did I question things? Yes, always. That's part of my job, is to question things, right? And the science is never settled, no matter what anybody ever says. So I worked my way up to a leadership position at the hospital that I was employed at. And I was the first non-physician to be appointed part of the medical staff. And I also sat on the medical executive committee, which is the highest committee in a hospital system. And I helped my physician colleagues to make decisions for the hospital, policy decisions, safety decisions. And then I also worked clinically taking care of patients. So I had two roles, and this leadership role was not something I necessarily wanted to be in. My chief medical officer at the time wanted me in that role. He, just through my exemplary service through the years, said, we need you to be a leader. We want you to be a leader. So, and it's often the people that stood up during this time were often those leaders, that they're exactly the people that you want to employ are the ones that ultimately seem to have gotten fired, unfortunately, for standing up for exactly what their job roles were. It's kind of crazy. So, I was going about my life just like everybody else, just doing my job. And then the pandemic hit, or whatever, the plandemic, whatever we want to call it at this point. And I worked during COVID, the whole phase of the viral illness and the admissions and the deaths and every awful thing that we heard and saw, taking care of patients through it all. Before these, gene therapy injections were released on society. So I had a pretty good idea of what COVID looked like before the jabs came out. And there were a lot of things that were wrong about the whole narrative. There was something very wrong from the get-go. And it's very difficult for me to understand how people, I guess if you're not in healthcare, you're watching the news and you're believing everything that was, a lot of people were believing what they were seeing. But the reality was very different for us healthcare workers, who kind of caught on to the lies that were going on. So then it helped to prepare me for what I was about to witness with the vaccines when they came out. And I always tell people, when I'm saying vaccines, people have to understand, I don't mean vaccines in the true sense of the word, because these were anything but, right? This was the first time an mRNA platform was introduced into human beings. And an mRNA platform is not a vaccine, it's gene therapy. It really is. It's a genetic product. So these came out initially in my area in December of 2020. Where I live in our health system. And they were first given out to our nursing home and high-risk patients, which, again, that was the right thing to do. I mean, if we're going to be doing this, we should be giving it to the high-risk people first. And healthcare workers were considered to be, at that time, high risk. I was never planning on getting an mRNA vaccine. What I was planning on getting was the Johnson & Johnson when it first came out, because it was via a platform that I had seen before. But at the time, that vaccine was not available in my community. Only the mRNA products were. And I would have had to drive a considerable distance, almost 2 hours, to get one of these shots and then go back to that same facility to get the second dose. And I wasn't willing to do that. I said, first of all, I wasn't going to get an mRNA injection. And second of all, I wasn't at the time willing to drive 2 hours, because I said, if something were to happen to me, I were to get ill or have some sort of side effect. I'm 2 hours away from home. I'm not going to do this. So I decided to wait. And I'm so glad that I did, that I didn't just jump in and stand in line like everybody else. I said, no, I'm going to kind of see how this plays out. I'm comfortable. I've worked for a year taking care of patients being exposed to this virus numerous times. I'm still here, so I'm comfortable waiting, and it was very shortly after we started introducing these vaccines to our community that I started noticing right away something was very wrong. Because I had worked at this particular hospital for over close to 15 years, almost 20 if you count when I was there when I worked in the lab. So I knew my community. We're a small town. I know exactly what comes in on a day-to-day basis. And all of a sudden, things started getting really weird. And the only thing that was different was these genetic products that people were injecting. And it wasn't as much, I was noticing weird things, but the patients themselves were also coming in and saying, ever since I got this jab, I've been sick, or right away after it went into my arm, I started feeling well, or I passed out at the vaccine center, and that's how I came. The patients were telling you something was wrong. I wasn't necessarily making a judgment call on them, even though I knew something was not right. I let them tell me what went wrong. And so I noticed this right away, and I started saying, man, something's not right here. I started going on the internet trying to figure out, if other people were seeing this just like me, or I was the only one. And that's when I discovered that there was this system in place that we were supposed to be reporting these unusual things we were seeing. And it was called the Vaccine Adverse Event Reporting System, or VAERS, which I think more people know about now than they did then, including myself. So I was on the website reading about what, these side effect reporting and what we're supposed to be doing and all of that, because I had not received any education prior to that there was even a reporting system, that there was anything we were supposed to be doing, because I wasn't personally giving these, vaccines out. I was just taking care of the people coming in after they were having their injuries, which at the time it was very confusing. I didn't know what was going on because I had never seen anything like this. So I educated myself on, what I was supposed to be doing. And naively, I thought that no one else knew, and really nobody else really knew about it, at least my immediate colleagues. Leadership, however, I'm sure knew, because they're the ones that signed the agreement form that they would report these things. But for us on the boots ground people, we didn't know we didn't receive any education about this. It was just give these vaccines and everything is going to be great and everyone's going to open up and the world's going to go back to normal. And that was so far from reality. So I educated myself. I started filing these reports myself on behalf of these patients that I was caring for. And I went to my higher leadership in my local hospital system and said, look what I've discovered. As a hospital system, we should be doing this on behalf of our patients. I, thought I was actually like bringing some new knowledge to my colleagues, and because I wanted to protect my organization from wrongdoing. That's what why I was doing it. I said, no, guys, we didn't know this. This is not our fault, but we need, now that we do know, we need to take care of these patients correctly, report these injuries, do the right thing, because these are brand new products. We don't have any safety data. This is an experiment. And we can't, we need to assure that these things are safe. And if they're not, we need to get them off the market. And I can't tell you the resistance I had. People looked at me like I was nuts. And I'm like, what is the matter with you people? You're all blinded. Like, just because they're telling us these things are safe, that's not reality. We don't know that. How can we know that? They've only been on the market a very short time, and it was very limited trial data that we had at the time. So I said, this is the time to not panic and be irrational. This is the time to stay focused and do our due diligence to society by reporting what we see, right? That's what we've done our whole careers. It was But when I look back on the whole COVID narrative, it was so purposefully designed and planned to get people to basically just conform and do what they're told and believe. It was such propaganda. I see it so clearly. I don't know how people don't see it. Again, maybe for me in healthcare, it's much easier because I lived it, breathed it, experienced it up front and personal. For the people who don't work in healthcare, I can see how, to some extent, some of them are still have a hard time coming around to the reality of what was done to society. But for me, it's so clear, and it's hard for me when I run into people in healthcare, especially those that were there during COVID. I mean, there's people in healthcare who never saw a COVID patient in their life. You know, they sat in an office or did whatever, or didn't see patients directly. But for those of us that were the boots on the ground, frontline workers, how any of them cannot see now the propaganda and just the lies that we've lived through. It's beyond me. It's just complete and total cognitive dissonance. I don't know. These people, there's no hope for them because if you don't see it by now, I don't know. So ultimately, again, I started filing these reports, and I did it on behalf of my institution as a volunteer effort. I was the only one reporting for all of the patients in my hospital. So I went to our emergency room, our fast track, all of my colleagues, and I said, hey, at this point, we don't have a system in place to do these reports. So I'm going to do it because it's just the right thing to do until we get a system in place. And so any weird things you see, any patients that come in saying that they think they've had a side effect or an injury, let me know about it. I'll, see the patient, talk to them, talk to the family, and get the report filed and take care of things, put it in the medical record. And I had a lot of people do that for me. Nurses, aides. I mean, everyone was giving me reports in the hospital. So if you can imagine, it became a full-time job because each one of these reports takes about an hour because they require so much information, so much medical information. So again, when you hear on the news, or any of your listeners hear on the news, that VAERS is not reliable, anybody that can report, yada, yada, yada. The truth is the majority of those reports are coming from doctors, medical people. These are not reports that are coming from just a no one. Plus, it's a crime if you lie. Who's going to take the time to do one of these reports if they're lying? It's just ridiculous. And so most of these are filed by medical people, and they're filed by the individuals that took care of that patient. Most of the time, it's what we're observing as clinicians. So this became my full-time job. I wasn't paid for it, but what I would do is I worked 7 on, 7 off. So I did 7 12s straight, and then I would have 7 days off. Well, on that 7 days off, that's all I did was file VAERS reports, talk to patients, talk to the CDC. I mean, it was a full-time job, and it got to be so overwhelming. It was taking over my life. So I went back and all this time I was talking to leadership saying, what are we doing for a plan here? How are we going to implement reporting in the hospital? What are we doing? And there was really never any plan, right? They were telling me they were working on a plan, but the reality was no one was doing anything. So I just kept escalating the concern and saying, look, I can't be the only person. We as an organization have to do this. I don't care how much you support the shots and the narrative. The reality is we have a due diligence to first do no harm. And I'm seeing harm being done, and we have to notify the appropriate authorities. Well, I kept getting just pushback, and that I was the only one, and I'm crazy, and I'm seeing things that aren't really there, and nobody in the system is seeing what I'm seeing, yada yada. And so I ended up going to the authoritative bodies themselves. I contacted the CDC, I contacted the FDA. No one got back to me. I shouldn't say no one. There was one person through the FDA who was at the time the director of consumer affairs who talked to me on the phone and was concerned about what I was telling him and promised that he would escalate it up the chain of command. But he also said, that's all I can do. And I understand that now, that there are people in positions of power who really do care and want to do their job. But then there's lots of people in positions of power who don't want to do that job or are not doing their jobs correctly. And so then all of my concerns just stopped right there with that one FDA person, unfortunately. But I didn't stop. I reached out to the New York State Department of Health. I reached out to our accrediting body of our organization. And I tried every avenue I could to notify the people that there was harm being done. And again, it fell on deaf ears at the time because the narrative was all about these shots were going to get us out of this nightmare. And anybody who spoke anything of that was, they wanted to just bury us. No matter what the consequences were, the harm that was being done. So as a result of me continuing to push for transparency, I started getting a lot of pushback from the system level. So my local community hospital encompasses a large hospital system that's located in Rochester, New York. That's about, I think it's up to 10 hospitals now. So it was when the system became aware of what I was doing is when everything got bad. And so what happened is the system wanted to do an audit of the reports that I had filed. So at the time, VAERS had very clear direction on which patients needed to have reports filed. And those were anyone with a serious adverse event. And a serious adverse event was, number one, a hospitalization, which I work in the hospital doing inpatient. All of these patients I filed were serious adverse events. So I picked really good case scenarios that met the criteria exactly and submitted those for the audit. I wasn't part of the audit. I couldn't defend my work. I don't know who audited me, but they ultimately came back and said, you're over-reporting, basically that I'm crazy. I don't know what I'm doing. And as my punishment, I can no longer file VAERS reports and any patients that I did not directly take care of, which means anybody in the hospital that would give me a patient that they knew about, heard about, I could not file that VAERS report. That individual had to file it themselves or it just didn't get done. And I wasn't comfortable with that because I said, first of all, as a hospitalist, I'm every patient in this hospital is my patient. Because the truth is if somebody coded, let's say, because I'm a hospitalist, so if somebody codes in the hospital, I'm not going to say, oh, I'm not directly caring for that patient because it's a resident patient or a colleague's. I'm just going to stand here and let them just code and I'm not going to do anything. That's not what we do as hospitalists. We're a team. And as a leader in the hospital, these patients are under my wing, right? I'm a leader. So they all belong to me. That's my job. So I was not comfortable with what they were telling me to do. And I said, well, if they don't file the reports, what's our plan? And they said, well, then you just have to let us know and we'll make sure the reports get filed. Okay. So that's what I did because these reports weren't getting filed. And what they basically said was, well, it's none of your business. And we can't tell you if they got filed, didn't get filed. It's none of your business. And I said, no, it is my business because you're breaking the law. You're committing fraud here on our government. You're billing for these vaccines and you're not adhering to your requirements for the safety reporting that's in their contract with the government. And then we'll talk about that quickly, but so every organization, anybody who gave out a COVID vaccine signed what's called the CDC COVID vaccine agreement form, which is a legal binding contract between the organization and the CDC and the FDA that basically has all these provisions for how they were going to make sure that everything was going to go out smoothly and they could bill for these vaccines, get the $40 fee. Because remember, these vaccines were basically being given out for free, right? They were being given to these organizations for free from the government, the taxpayers. We paid for them. And then these organizations would bill for administering that vaccine. And each vaccine was $40. It was originally $22. And then under the Biden administration, they doubled that to incentivize people to give out more vaccines. So it was like $44 a shot, right? That's a lot of money if you think of the millions of people that got these. Yeah. But as a condition of that payment, mandatory VAERS reporting was a requirement. So if you don't do the reports, or you suppress someone who's trying to do those reports, you're committing fraud on the government. You're stealing money from the taxpayers because you're not upholding your end of the deal with the contract. And that's every organization across the board, from your pharmacies to your offices, your hospital systems. They all signed that contract. It's called the COVID provider agreement form. So I knew about that, right? And I knew that this was a fraud issue because of course I knew they were billing for these vaccines. You don't do anything for free in medicine. I mean, so ultimately, because I kept pushing for this, it just got ugly for me. And they kept calling me into meetings and interrogating me. And then at one point they threatened to report me to the state for misinformation, for basically to have my license revoked. So at that point, I was able to secure some attorneys behind the scenes. I'm very grateful to them. That was Aaron Seary and Elizabeth Brem were two attorneys from the Seary and Gilmstead law firm who helped me behind the scenes make sure I was staying within the law, while gathering evidence for what was going to eventually be my lawsuit against the organization. At the time, I had no idea. You're afraid. You don't know what's going on. I've never, ever been involved in a lawsuit or any of this. I'm just a regular person. But it was so abhorrent what I saw was going on, and just the complete and total just dismissing of safety was just so disgusting. It was so against everything I was ever taught as a medical provider. I could not and will not ever let this die. Because it's just so fundamentally wrong. Because in healthcare, the number one thing is to first do no harm. Before you touch that patient, do anything to that patient, you have to make sure that what you're offering to them is not going to harm them. And if it is, or you don't know if it's going to harm them, you have to tell them. You don't coerce them, and all the stuff that I saw go on. Just disgusting. So ultimately, I knew I had to come public because no one was listening. Nobody cared. I could not stand what was happening to these people of my community. And I ended up going public. I first went, the New York Times interviewed me when the mandates were coming down for the COVID vaccines. I did a piece for the New York Times talking about why I wasn't getting vaccinated at the time. And I said it was because of all these injuries I was seeing. That's why I wouldn't get a shot. There was something very wrong. So they were the first people that I did an interview with. And then shortly thereafter, I came out and whistleblew on the high wire with Del Bigtree. And that forever changed my life because a little more than a week later, I was surrounded by my HR department in the middle of my shift on the busiest hospital floor, right after I came back from lunch, like FBI style, just surrounded, get your things. And they put me in a room and basically interrogated me about why I went on the high wire, why I went to the New York Times, why at the time I had a GoFundMe account. Because one thing Dell told me to do is to start a GoFundMe account prior to me being fired, because he's like, they were going to destroy you. They're going to take everything you've ever worked for. And they sure did. So he said, you've got to protect yourself financially, because at the time, my husband was a stay-at-home dad. And we have 3 kids. At the time, they were very young, and I was the breadwinner. And so I knew I was going to be destroyed. So fortunately, he helped me with that GoFundMe, and I was able to secure a little bit of income before I was fired. But they didn't like that. They didn't like that I had started and I remember telling them, what do you think? I'm stupid? You think that you're not going to do? I knew this was coming. Like they think I'm stupid. I'm not. I'm very smart.
Yeah.
And they were hoping it was going to go away, and no, it's not going away. So They ultimately walked me out. It was very public, very embarrassing, very humiliating. It was a horrifying day. When I look back now, I still get anxious about it because it was so surreal. But they marched me right out of that hospital and threw me out. I still have things in that hospital because I was there almost 15 years. I couldn't get my things. I could only take what I had on me at the time. And that day, everything was canceled. My health insurance, my retirement, everything was canceled.
Oh my gosh.
And then I couldn't get unemployment because I was subordinate, right? So New York State wouldn't allow you to get unemployment. So I thought it was over, right? I thought I was going to lose my house, everything I had worked for. But fortunately, that didn't happen. Shortly after I was fired, a local small family practice who heard about what happened to me called me and brought me on under their wings part-time. And I'm still there just part-time. But they were able to at least give me some income and some security, that I could still have somewhat of an income coming in. And then with the support of the public through the GoFundMe account, I was able to keep myself and my family going till my husband could secure employment and all of that.
Yeah.
So we're still here, 4 years later. But it was a struggle after I was fired because I couldn't get other than the small community practice that I worked at part-time, no one else would hire me, right? Because they don't hire whistleblowers. Nobody does, because you're out there, you're public, you're a conspiracy person, and you get smeared all over the internet. And the local newspaper in my town also smeared me as well. So yeah, it's just awful. So,
my gosh.
But then fortunately, a few years later, through doing podcasts and that, I met Steve Kirsch, who runs the Vaccine Safety Research Foundation. And I did a couple pieces with Steve. And then I was looking for an attorney to help me because at the time, the firm that had helped me behind the scenes did not have a false claims attorney on their staff. And we didn't know what we had. We didn't know. I just knew what happened was so fundamentally wrong and illegal, but I didn't know how to go about it because I've never been involved in anything. So I was calling attorney firms, trying to get a hold of someone to help me figure out what we could do. And no one would talk to me. Again, it was like, you're totally gaslit. Like, you want to do what? These vaccines are great. What are you talking about? Click, nobody would talk to me. But Steve Kirsch had Warner Mendenhall on one of his podcasts because he's one of the attorneys on the Brooke Jackson Pfizer case, the big Pfizer case that's been going on for a couple of years. And there was just something about Warner that I said, this guy seems to get it. He seems like somebody that genuinely cares and wants to do something about this madness that we have going on. So I reached out to him and he personally called me, which was shocking to me, just shocking. And we talked for a while. And again, because this was new to me and I had no idea what I was even doing, I just knew I had a lot of evidence, but I didn't know the significance of what I had. He just kept saying to me, I need something that links them with a crime. Like, you can't just have this, like, we have to have something that'll link them to billing fraud, something like that. And I'm like, what do you mean? Like the contract? And he said, yeah, I need like a contract. Do you have I said, I have a contract. So I had that COVID-19 program participation agreement, which was the key. Because in there, it said reporting to VAERS is a material condition of payment. And you have to have materiality in a False Claims Act case. And it says clearly in the agreement that violations of this are violations of the False Claims Act. So that's what we needed. So we filed the first ever False Claims Act lawsuit in Buffalo Federal Court in the Western District. It was under seal for about a year because at that time it has to be under seal so the government can do their own investigation. That investigation was done under the previous administration, keep in mind. And they ultimately didn't want to join in with us on the lawsuit. I don't really know why. Warner thought that it might be because it was kind of small fry, in the sense that at the time it was just a small community hospital, not enough for the government to get involved. But obviously now, many years later, since we filed that and everything that's coming out now, it's perfect timing, right? So we survived the motion to dismiss at our last hearing, which obviously the hospital wanted the case dismissed against them. They don't feel they did any wrongdoing. And one of their main things was that, the government didn't want to get involved, so they shouldn't be liable. It shouldn't be their fault if, the government doesn't care. And fortunately, our honorable judge said, well, the government doesn't always do their job. So that was pretty awesome. So we survived the motion to dismiss, and we are currently in discovery. And we're hoping to be in trial by sometime in 2027. So basically, the lawsuit is the first federal False Claims Act trying to hold an organization accountable for not reporting to the vaccine adverse event reporting system the thousands of injuries that occurred under these COVID jabs under emergency use. So this only applies to the emergency use product, not the FDA approved product. But that didn't, while it got FDA approved fairly early in the narrative, the actual availability of those FDA approved vaccines were not there. So the majority of the people got the EUA product, the emergency use authorized product, which was not the FDA approved product. And we can easily figure that out through lot numbers and all of that. So this potentially involves thousands upon thousands of patients. And it also includes the entire Rochester Regional Health Organization. So not just my hospital, this is every entity involved in the Rochester Regional Health System, from their pharmacies, their hospitals, their outpatient clinics, their nursing homes. Every patient that they gave a COVID vaccine to, that then that patient experienced a serious adverse event, or any of those, myocarditis, pericarditis, there's just so many different injuries, and they didn't file a VAERS report, that is considered a false claim. And every false claim has a maximum penalty of $27,000 and 3 times that $40 that was stolen from the taxpayers. So if you can imagine, every report they didn't file has potential fines of $27,000. That's a lot of money if we're talking about thousands of potential patients that this happened to. Now, that money doesn't come to me. I'm not filing this lawsuit on behalf of myself. This is the government that was frauded. Ultimately, us, the taxpayers. That money goes back to the government, to the taxpayers, right? Because we were the ones that were frauded. Our incomes and everything get taxed, and those taxes go to fund these vaccine programs. And so we rely on these organizations to do their job, and they didn't do their job, and they took the money anyway. So us taxpayers deserve that money back, So I'm filing this on behalf of the United States of America, and the actual case is called, the United States of America versus Rochester Regional Health, because that's what I'm ultimately filing it on behalf of. Now, I do have my own whistleblower lawsuit on the side, which is obviously being wrongly terminated for doing my job. And as a whistleblower, there's some protections afforded to whistleblowers, especially when you're blowing the whistle on government issues, federal issues like myself. But that's irrelevant compared to what we're dealing with here on this Federal False Claim Act case, because the reality is this wasn't just my organization that this happened to. Every single health system did not file these VAERS reports. We know that. And to this day, there are pharmacists and hospital systems that are still not filing these reports. It is absolutely disgusting. as a healthcare worker, if you don't know about the VAERS system, shame on you at this point. I didn't know at the time when this was happening, but at this point, all the media attention that's been brought to it, how can you not know? You know?
Mm-hmm.
So yeah, that's my story. Long story short, but I wanted to make sure everybody understood everything that happened, because there's a lot of untruth going on. But we hope to be successful in this. We have an amazing judge, and we have now 7 attorneys that have joined my case. And they're all doing this because they believe in the cause, they believe in the mission. Because if we don't fight, if somebody doesn't stand up for what's right, we're all doomed, right?
Yeah.
I mean, maybe we're not going to win this. I don't know, but at least I can go to bed at night knowing that I tried.
100%.
And I'm not a fraud, right? I don't go to work every day as a healthcare worker claiming that I take care of patients and I'm all about safety when I'm not, right? At least I can say I actually stand up for what I say I do, unlike so many other healthcare workers out there who know what's going on and they're staying silent. And I have no respect for those people. I'm sorry, but I don't. I don't want to hear about how they can't afford to lose their job in this. I couldn't either. But at the same time, I can't afford to lose my dignity. To me, that means more to me than any job. It's not beneath me to just leave my career. I don't care, because at the end, I answer to God. You know what I mean? And I don't know. Yeah. I don't know what's wrong with people. I really don't. This is how horrible atrocities happened in history, is because people stayed silent. I will not be part of that.
Exactly.
Yeah. Wow. What a story. I mean, there's already, I feel like, oh my gosh, I'm like boiling over with questions and thoughts, and there's so much there. But Dad, I'm going to just let you go right into it. First of all, Deb, thank you for sharing all of that. I know that's a lot to probably tell and retell through the years.
No, it's fine. I feel so bad because I talk so much, but it's such a huge story. I don't know how to make it any more condensed.
Yeah, and it really is important. And, like you said earlier, there are still people that just are not waking up to this still. And even you're talking about these medical providers still that this far into it are staying silent. It's like, how is this happening? So thank you for that. But Dad, I'm just going to pass the ball to you here. You get your questions in.
Yeah, Deb, again, thank you. I certainly did not want to interrupt, but there was at least 100 places down through your description of these events that I would have liked to expound upon. You did a great job summarizing it, getting into 45 minutes or so. It's just a hell of a story, what you have been put through, but the bigger picture, and you've alluded to it, this stuff still goes on. The fact that there are people out there knowingly allowing these grievances to happen against the people who they are supposed to be caring for. Now, as a former law enforcement officer, one of the things that we were instructed in order to determine culpability, we called it RINK, recklessly, intentionally, negligently, or knowingly. And knowingly, to me, seems like a thing that is still going on. There is knowingly avoidance of a system that they all signed a contract to comply with. Shouldn't all these people be in violation of that? Shouldn't they all be able to be held accountable for this very act of continuing this grievance against the American public? This is an outrage. People should absolutely be ready to tear the walls down. That here there is harm being caused, whatever the percentages were. We, the people who are being subjected to this, in many cases mandated to take it, have the right to know the risk associated with it, and it was knowingly kept from us. I got to believe, Deb, that the people you were working with knew you were exposing what they also knew. They were just afraid to get in the middle of it. That is terrifying.
Absolutely. And don't get me wrong, many people ultimately lost their job at my hospital because they did not get vaccinated. And I hope that some of that was because of what I was fighting for, because many people were seeing what was happening. It wasn't just me. And many people unfortunately lost their jobs. And I talk with many of them because many of them left healthcare after that. It's very sad.
Sure.
And there's many that stayed and got vaccinated against their wishes. They didn't want it, but at the time they couldn't leave their job or whatever was going on. And then they ultimately left healthcare, or they got divorced, or they ended up developing an addiction because they couldn't live with what they had to do, right? Like there's so much suffering that has come out of this, even for those who chose to get vaccinated at the time. And then the acknowledgement now that maybe some of them woke up and realized they are vaccine injured. And the anger. I mean, I see it in the practice that I work at. I have patients who felt forced to get these vaccines, and now they've got medical problems they didn't have prior, right? That came on shortly after, heart attacks and all sorts of things. And they have to now live with that knowledge and know that there was this fraud that went on, that we could have stopped it. I'm not the only person that was speaking out about the lack of VAERS reporting. There were many people doing it across this nation, across the world, but we were all gaslit and suppressed and threatened. We were trying to get the information out. We were trying to, and the people that are responsible to, so people love to tell me, oh, well, you're saying the vaccines, by filing, I heard this a lot from my colleagues, by filing a VAERS report, it's basically saying that the vaccine caused the event. And I said, look, I don't know. I'm reporting what I'm observing and what we're required to do. Just like I said, child abuse, it's a perfect analogy. I'm a mandatory child abuse reporter. If I have a child that somebody says to me, oh, we think he might be abused, and I have knowledge of it, as a healthcare worker, I'm mandated to report that. Whether I know if the child's being abused or not, it's not my job to determine that. Somebody at CPS, it's their job to go in and evaluate the situation and see if it's happening. That's the same with VAERS. The people at the FDA and the CDC, their job, they're getting paid to look at these VAERS reports and look for signals. That's their job. But if you're suppressing the people from filing the reports, how are they supposed to do their job? Now, again, I got my own ideas about that because they knew that we were being suppressed. And again, no one did anything about it at the time. But I mean, again, I don't know who knew. I know some of the people that knew specifically, but I don't know what was going on behind the scenes. And the great thing about the discovery process of this case is we're going to figure out exactly who knew and why they didn't do their jobs. From the government officials to the health system leaders, we're going to know who wasn't doing their job. And hopefully there will be justice for these individuals that harmed all of us, right?
Absolutely.
And our community members.
Yeah. It's incredible to look around and recognize, even without being in the medical field, you can just look at your peers, look at your neighborhood, look at your communities, and pick out these things, these nuances that are very new, very recent. We were not seeing certain things happen before the vaccine rollout. So it's amazing to me that so many people in your position either turned a blind eye to it, or, still 5 years later are saying, no, I don't think it connects. It's just,
I know.
It's truly baffling. And so the one thing I'd like to back up to, if we could, I know right now when you're looking in the rearview mirror, it's probably so obvious why you were met with such resistance. But when it first happened, what were your initial thoughts? Because you could have stopped right there. You could have put on the brakes, but you didn't. And I'm curious, how did you navigate that initial time frame where you were being met with complete opposition by your own leaders?
You mean why? What kept me propelling forward despite them?
Yeah.
I just knew I was right. I just knew, despite them telling me that I was crazy, basically, that I was the only one seeing it, that was just not reality. And I can't tell you how confusing of a time it was, because I remember, just sometimes leaving my job and just saying to myself, am I crazy? Is there something, am I not seeing? But then what would happen is, like, somebody would reach out, via email, or somebody would call me, or behind the scenes. And I'd say, you know what? I'm not crazy. Like, other people are seeing this too. But then I'd said, well, why would they gaslight me? Why would they not want to see it? And then I started, because again, I didn't look at these people like they were fraudsters, or these were my colleagues. These were people that I worked with for 15 years. These were my friends that were turning their backs on me for a narrative because they were propagandized, or they were incentivized, or whatever was going on behind the scenes, or they were just willfully blind. I mean, this stuff is powerful. I mean, we saw it during, the Nazi Germany days, right? Where people, this propaganda can really get in your head and turn you into a monster, where you do horrific things and you don't see, what's right in front of you. It's unbelievable. And I just knew that I'm the sane one, right? Like, I'm not crazy. This is really happening. And like I said, and then it took things like, speaking with like Senator Johnson, I spoke with him early on, and he was very validating about what was going on. There were many people through this journey that helped me see that I was doing the right thing. And that the reality was, some people are either just terrible human beings, they're demonic, they're possessed, they're willfully blind, they just don't know. I mean, there's so many factors that came into it that can only explain why, I don't know. Because I can't tell you how many emails I would send with copies, printed pictures of the VAERS website saying exactly what I was saying. And they're like, nope, that's just not true. I don't know what you're seeing, Deb. And I'm like, what? And they're calling me crazy. Like, it's right in front of you. But fear does that. It makes people irrational, right? And we were dealing with a time of extreme fear. I mean, none of us have ever been through this in our lives. And I mean, we've read about, these types of things in history, but to actually live, it was like being in a war zone. I mean, people were panicked everywhere. There's still people that are panicked. I mean, go to an airport, there's still people in masks.
Yeah. That's true.
It's awful.
Yeah.
Right.
Yeah.
There's still, and I don't think there's any fixing those people. They're gone mentally.
That's correct. Right.
It's sad. It really, and the sad part about it is many of them are young.
Yep.
If you notice, many of them are young. They're not, 80-year-olds who are high risk. These are 20-year-olds often that are low risk, healthy individuals who now believe that the world is a big germ, and they're
so true.
They've lost trust in their body's ability to fight infection. It's really sad. And many of the times it's because their bodies can't fight infection anymore, because their immune system is so destroyed from this that they just get sick over and over and over again.
Yeah. 100%.
They placed their mistrust in the wrong spot.
Yeah.
Yeah.
Absolutely.
Hey, Deb, I was curious, have you been cautioned about engaging in these type of podcasts and discussions, since this is an ongoing case?
No. So at this point, everything that's going on with the case is public, because this is your lawsuit, right? This is not. So this is a very public lawsuit. Yes, I can speak about it because everything is on my website. Anytime we do anything with the courts, all of that documentation is on the website for the public to know. And the public has come to the hearings. I mean, we had a pretty good showing in the Buffalo Western District of the federal court at our last hearing. People are interested in this. And I welcome the public to be there in the courtroom, because this is our lawsuit, right?
Yeah.
And the public has the right to know what's going on.
Well, my follow-up question to that, I wanted to make sure that there wasn't anything like that, because oftentimes there is on ongoing cases. It's stuff that they really don't want to be out there, but I understand the background now. My my
Mhm.
my question in response to that is, at the end of it, when we read through all of this, we know that there were doctors and others in the medical profession that were complicit in hiding what they were recognizing. The media, I would suggest, was complicit largely, the
Mhm.
traditional media outlets. But when we read through all of it, did the leverage come from big pharma?
That's what we're going to hopefully find out through discovery is
Mm-hmm.
where did this information ultimately come? Because I mean, the health systems had a boss too, right? Like with the whole ivermectin debacle across the nation, every health system gave out these emails to their employees. You can't prescribe ivermectin; it's not FDA approved, and blah 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 blah. This was systemic. This was across the nation. So this
Correct.
came from somewhere higher up. And I
Correct.
believe it was the same with me with the suppression of the VAERS reporting, because, like I said, there are other people, other whistleblowers surrounding VAERS that have the same story as me.
Yep.
So it's a systemic capture. And where does it come from? That's what we hope the discovery process will reveal. The
Mm-hmm.
reality of who was directing what and where did it come from. I
Mm-hmm.
believe it came from high up. It had to have.
Mm-hmm.
Even like the state health departments, they have a boss too, right?
Mm-hmm.
I mean,
Well,
so
we
yeah.
we here at the Fourth Box, and many of our previous shows, we've alluded to it. We really think that even our elected officials are owned and controlled by bigger forces behind them that the American public just doesn't have the ability to recognize easily. And that's really what it seems to me like. The dictates were coming down that this is going to happen, and here's what we're going to do. And anybody who stands in opposition is going to get bowled over one way or another. So I am sure insiders, medical professionals such as yourself that were pointing this out were voices that they wanted to squelch as quickly as
Absolutely.
possible, call you crazy, all of those things like they did to Ron Paul back in the early days of his presidential campaign. They tried to make him look like a lunatic because he was an outsider that was completely going to expose. We thought Donald Trump was going to do a lot of that too, completely expose who really has their hands on the levers of control down there. And I hope and pray that this case that you're involved with does. I'm only concerned that is it too big that the courts can't even control it. That is my
Right.
concern.
And
Yeah.
that's something that, the biggest frustration with these cases is the courts, right? It's the
Yep.
biggest frustration because they drag on and on and on.
Yep.
We were hoping to be through discovery and into trial in 2026,
Mm-hmm.
but unfortunately, this is now going to be extended into 2027 and maybe beyond that, because the reality is, like, the health system, people forget they have insurance, right? They've hired
Mm-hmm.
one of the biggest firms in the nation. They've got an insurance policy that's covering all their legal expenses. What do
Mm-hmm.
I have? I have
Mm-hmm.
nothing, right? My
Exactly.
attorney has nothing. We are, and it's expensive to take these
Mm-hmm.
cases to trial. It's hundreds of thousands of dollars. And
Mm-hmm.
and I don't have an insurance policy, right? I'm bringing, so I mean, to fund this is unbelievable. And so most people just give up, right? They just
Mm-hmm.
they just say, well, forget it, or they'll
That's what the,
settle, right? They'll,
that's
they'll
what they
settle
count
or
on,
whatever,
Deb. A
that kind
hundred
of thing.
percent.
And that's the
That's what,
reality, is they drag it on. And I mean, I'm I'm in this for the long haul. It's frustrating. It really is. There are days that I'm just like, what are you doing? Like, just stop already. But I can't. I don't know. I can't give up. I won't, you know?
well, we absolutely commend your efforts, and we'll certainly share this as far and wide as we can. I did have another question related to the to the discovery. Who who is involved with the discovery? Who is going out, kicking through the bushes, kicking through the documents, and expected to come back with some integrity and report what is found?
Yeah, so that's a good question. I mean, I don't know much about this process. I just know that, the hospital wants to, part of the discovery process is having to just depose some government people, which is a long process. And then obviously deposing on our side some of these individuals that were involved in the suppression of the reporting. And I believe, just like with any of these other trials going on that are False Claims Act or any public lawsuit, when we start doing this discovery process, the public should be able to watch or any of this kind of stuff go on, any of the depositions that go on. I imagine that's something that the public should be able to watch. I don't know if we're going to record it. I'm not sure what exactly we're going to do, because we haven't yet, to my knowledge, deposed anyone just yet at this point where they're gathering documents or whatever. But I know that there'll be depositions coming up soon.
Okay.
Yeah, and I plan on, keeping the public very well informed on what's exactly going on with who we're deposing and all of that. My attorney. Go ahead.
You worry about who is going to be involved with the collection of data, the storage of evidence, and bringing that evidence to the courtroom where it can be viewed publicly, or at least it's supposed to be able to be viewed or listened to publicly. But who are the people behind the scenes that are going to have their hands in that cookie jar, so to say, and be responsible for bringing that forward? Because as we just talked about, are the forces already got their hands on those very people?
Right. I mean, we obviously we want the Department of Justice to take this case. I mean, this is ultimately the Department of Justice's case, and we would love for them to join in now under the new administration and a new attorney general. We've tried to, bring through, again, podcasts and all that. We're trying to bring an awareness in Washington again about what's going on with this case, in hopes that Pam Bondi might see it and be willing to jump in. We would love that, because that takes a lot off of us, because it's a lot of work. I mean, we have seven attorneys that have joined in on my side to help with this, because it's massive. But certainly having the DOJ join would be so helpful. At this point. But yeah, it's really tough, because you're right. I mean, I don't know ultimately who's in charge at the top. And I don't think they want this information getting out, right? We don't,
correct.
I mean, even though there's so much coming out now about this admission of 10 children that died after the COVID vaccine, this admission from the FDA, it's a start, but the reality is 10 is nothing compared to the real reality of the deaths that have because I mean, I only did adults, and I can tell you how many deaths I filed. So I can't imagine what it was like. And again, who filed these deaths on behalf of these children? I'm sure they were the doctors taking care of them in many of the cases. And there weren't just 10. There were many, potentially thousands across the country. And I know one of they said this evening who they're starting to reveal the names of those 10. And they've released the name of the first. And it's heartbreaking, because I know the father of the first one, the first death that they're admitting. And it is so heartbreaking. He has been through so much as a father. I just can't imagine. And it's heartbreaking. Many of these individuals I know personally.
Yeah.
And it's heartbreaking that a child, they should pull these shots off the market. They need to come off the market. Period.
100%.
End of story.
100%.
If they're admitting they caused 10 children to die, that should never happen.
That's correct.
It should never happen. And so they need to stop these shots. But the powers that be, I don't know.
I think it was pretty early on in the discussion tonight that you mentioned demonic forces. I firmly believe that there is evil operating amongst us. They are in these positions that are putting leverage on others who are doing what they believe is dutiful, or to keep their job or whatever. But I honestly think, as we've talked many times, this is a spiritual battle. This is good versus evil. It's very obvious that people that are turning a blind eye to patients being hurt and or killed as a result of this, there is clearly evil in these positions. I don't know what else to call it.
Yep. I've said it from the very beginning. This is a spiritual battle. I've felt it. I've known it. It's, and when you asked about kind of what keeps me going, that's what keeps me going, is that I know this is my mission. However it's going to end, I really, I'm not at the steering wheel here,
Mm-hmm.
I'm on the side of good. And,
Amen. Yep.
I'm just coming along for the ride as the vehicle, right? And I hope it ends well. Of course I do, but ultimately it's in God's hands, and He used me for this purpose, and I am doing whatever He needs me to do at this point.
Absolutely commend you for what you're going through and your efforts, and anything we can do to help. We will certainly post all of this information up. Love to have you back on as this thing unfolds.
Me too.
It's been just an overwhelming. I mean, a lot of these things you suspect and you pick up bits and pieces, and we discuss with others and ourselves, people around the country, and you feel that this is what's going on, but it's not a relief, because it's not, but it's clarifying to have somebody on the inside frame this for us, and to be able to share this with our listeners. It's great.
Absolutely, because I'm sure you guys, just like me, you were gaslit and called crazy, and there were times that you were like, am I? I'm sure. And when you speak with somebody that's been through it, you're like validated. You feel,
yes,
I'm fine. I am, because it's a surreal experience, because you see it with such clarity, but yet others are blinded. And again, I've never experienced anything like this. It is truly a spiritual battle, but it's also awesome, because I'm so glad that I'm on the side with my eyes wide open, right?
Yeah.
We're given a vision
Absolutely.
from God that so many others don't have. And it's awesome to be on this side. As hard as it is, I'd much rather be on this side.
Of
right?
course.
I think we completely agree with you there. I know we're like just flying through. We're already past an hour. So if you don't mind, I've got one more question for you.
Yeah, please. Yeah.
Have you had luck connecting with other people like yourself who are going through similar things around the country? I suspect if you're able to kind of make those connections and having that network on a bigger scale probably helps you from an emotional standpoint, but also pushing this further down the line and maybe getting it into the hands of the Attorney General and so on. Have you had luck with any of that?
Oh, very much. I mean, just recently, I've had some people in government reach out to me because they saw me speaking on a podcast. And so there are good, and I don't want people to think like all government's bad. There are
Correct.
really good people that work at our health agencies, just like you and I, but they're stuck in a swamp of the same type of situation that I lived and you guys have lived, of people who are willfully blind, possessed, evil, whatever, I mean, and they're too asking themselves, am I crazy? You know what I mean?
Yeah.
And because I've met some of these people, and they've reached out to me, and I give them hope. And that's what's so awesome, is here there's some high level people that I've come into contact with that, I mean, I'm like, oh my gosh, almost, starstruck, and they're feeling the same way about me because I'm validating what they're feeling. Right. So it's because in the end, we're all just human beings, right?
That's exactly.
And we're all, I don't know. It's just been so yes, I have met so many incredible people on this journey. It's been so amazing. Just this year alone, I have traveled so much. I've been to Texas like 4 times. I mean, it's crazy, but I'll get somebody call and just say, hey, Deb, could you come down and do a show, or can you speak at an event? And I'll go, and it's hard, of course it's hard to do, but I mean, it's what I'm called to do. I never thought this was going to be my life, just like everyone else. You just think you're just going to go, and it's funny because, every day I would say a prayer before going to work about being used for God's purpose. And, whatever you need me to do, I'll willfully do. Well, then one day he called me on it. Right.
Yeah.
My cat is in the way here, but I mean, he's like, we're ready for you, Deb, and then you're like, oh, am I really ready? And that's a whole nother story in and of itself, because that was a pretty incredible night that I realized that of who was really in charge of this mission. And it was a very surreal experience. And that is ultimately what has given me the strength. Because I'm just a regular person like everyone else. I'm afraid, but when you've got God behind it, you can move mountains. It's pretty awesome.
100%.
Yeah.
Well, the country surely owes you. Yeah, we all owe you a debt of gratitude for what you're going through, your family and yourself, your kids, your husband, everybody, to allow you and to give you the opportunity to continue this fight. We all certainly, win, lose, or draw, owe you a debt of gratitude for bringing this to the forefront. We're very grateful to have you on the show tonight. Bree, did you have anything else?
No, not on my end. I mean, I'm sure we could talk for hours. So like you said earlier, Dad, if we could have you back sometime, I'd love to catch up with where this whole lawsuit goes. But if you'd like to just share where everyone can find you, everyone can find all of the details of this lawsuit, all of that before signing off, that would be perfect.
Absolutely. So I don't have a lot of social media stuff. I obviously for obvious reasons, but I do have a website. It's called IamDebConrad.com. That's where I will keep everybody updated on what's going on with the lawsuit. Even at this point, they can read all of the documents, the filings, everything we've done to this point. So pretty much that's where I'd say to follow me, because I really am not on much else. As you see, I had an old AOL email still, but it's good. It's good that way too. But yeah, so and I try to put podcasts on there as well if I'm doing something new, so people can follow. And yeah, I'll definitely keep everybody updated as we move along in 2026. I'm really excited to get through the discovery process and everything. So yeah, I'd love to be back on the show and update everybody on what's going on.
Awesome. Perfect. Thank you for sharing all of that. This has been such a treat. I don't know if that's the right word, but it is great to hear your story from you directly. It has been so enlightening. We always close with a Bible verse. So if you'd like to stick around for that, Pops will lead us there, and then we'll wrap it up.
Okay.
All right. And I'm going to take just an extra minute prior to the Bible verse. We're going to say a prayer, Deb. We're going to say a prayer for you and your efforts. So Heavenly Father, we gather tonight in your name and the name of Jesus Christ, our Lord and Savior. And we remember in Matthew that you promised where two or more are gathered in your name, that you would be in our midst, Lord. So we welcome you to this podcast, and we are calling upon you to shower Deb and all those involved with this effort, Warren Mendenhall and the other attorneys who are pushing this effort forward. Lord, send your Holy Spirit to be with them, provide them strength, provide them guidance to bring truth to the forefront so this country will recognize what has gone on. In Jesus' precious name we pray, amen.
Amen.
Okay, for my Bible verse tonight, he said, if you listen carefully to the Lord your God and do what is right in his eyes, if you pay attention to his commands and keep all his decrees, I will not bring on you any of the diseases I brought on the Egyptians, for I am the Lord who heals you. Exodus 15, verse 26. It was our great pleasure, Deb, to have you on tonight. Look forward to hearing more about it and to stay in contact with you as this thing unfolds.
Thank you. Thank you both so much. Have a great night.
Thank you. You too. Take care.
Bye-bye.
Wow. Yeah, that's all I can really say in response to that. I think we barely scratched the surface of all Deb went through in the last 4 years of her life. And it really puts into perspective when we say this is something we can't let go. This is such a great example of that. I mean, this has consumed her life, her family's life, everything she has and is consumed, because she is dedicated to the truth. And that is such an inspiration. It should be used as such a motivation to all of us. I mean, this is what we are called to do. We are called to stand up for truth no matter the cost. So I think you said it best, Dad, in saying that we all owe Deb a debt of gratitude. Absolutely.
Yeah. And I think, as we mentioned back a few weeks ago in one of our podcasts, we will continue to mention here on this podcast that this is a battle of good versus evil. And people who can turn a blind eye and pretend not to be noticing, or to be hiding up deaths and or serious injuries or any injuries to people who they are supposed to be caring for, somewhere along the line there is evil that has influenced these people's lives. And we have to come to grips with that fact. We have to recognize this is a spiritual battle, and we have to recognize what we need to do to prepare ourselves to engage in that battle. Seek out the truth, get on your knees and pray, and be thankful for every day we have to continue this fight, because it is good versus evil. And you can see by the description of this story, the evil will do anything to trip up the truth from getting out to we the people.
Yep, 100%. So this is one we will definitely follow up on. We're very fortunate to have had her join us. Obviously, she's been very busy, and I'm sure will continue to be quite busy through all of this. So we will definitely have her back on the show as soon as we're able. Great episode. Thank you all for joining us once again. Please, as always, remember to share this message with anyone you can. Deb took her time to join us and share this with all of you. So please share it with one person, share it with 20. Her message needs to be shared. And for those of you who are listening in the Western Pennsylvania area, you're not that far from Rochester. If you are interested, I am quite certain on her website, iamdebconrad.com, when these trials start to happen, it's something you could attend. So
very good.
Definitely keep an eye on that as well.
Yep.
Alrighty. Well, there you have it, folks. Until next week, stay vigilant.
Good night, everybody.
Thank you so much for listening. We really do appreciate the support and truly love getting to share this message with anyone who wants or needs it. The best way for you to support the show is to subscribe, add a rating, and share with everyone you know. You can find us on Instagram, X, and at thefourthbox.com. We'll see you next Thursday at 6 p.m. Stay vigilant.